Welcome back. Now, with rising cases and low awareness, Namibia is stepping up with its first ever prostate cancer conference taking place from the 15th to the 17th of May 2025 at the School of Medicine at Dr. Hage Geingob Campus right here in the nation's capital, Windhoek. Now, this landmark event will bring together experts to promote early detection, share the latest research, and raise public awareness on prostate health. Joining us this morning to talk more about the conference and why it matters is urologist Dr. Penoshinge Shikonga as well as Dr. Bonifatius Steenkamp. Good morning, doctors, and thank you so much to both of you for making time to speak to us this morning.
Good morning.
Good morning, and thank you for having us at this platform. And good morning to the viewers.
Dr. Bonifatius, let me perhaps start with you. Why prostate cancer is specifically becoming a significant health issue in Namibia, and what are the main issues that are contributing perhaps to its late diagnosis?
So, prostate cancer has become very important because it is so common. It is so common that the Cancer Association of Namibia has actually declared it the #1 prevalent cancer or malignancy in Namibia. And with regards to late detection, it has to do with multiple factors. For one, because of lack of information, still lots of room for improvement in drives to awareness campaigns to make men aware about screening and early detection. But it also has to do, to some extent, with regards to the early onset of prostate cancer, especially among men of African descent and among men who have got a family history of prostate cancer. We know that it's an inherited disease. We have identified the genes that confer inheritance to men in prostate with regards to prostate cancer. So this onset is early, and most of the time it's quite aggressive. And so if men don't come early for screening and early detection, then obviously they are picked up in an advanced stage.
Okay. Dr. Penoshinge, let's talk about how communities and health workers specifically talking the fact that he's highlighting that men from the African heritage side, or from African culture, mostly are the ones that are prevalent to this. What can we do between community health workers as well as communities in general to ensure that, we encourage men possibly, to get rid of this stigma? What needs to be done?
Okay, I think it starts with us as healthcare providers, because we are the ones that are well equipped with the information. So it's very important for us to go out there to the community so that we can educate our men as well as women, because it's just not a man disease, but it also involves females as well. So educating the community, holding community awareness, going to the radios in our native languages is very important. We know that men are not really healthcare seekers. They come when it's late. So it's up to us as healthcare providers to make sure that our male population is well educated with regard to this disease, how it presents, the signs and symptoms, so that they can present as soon as possible.
Okay. Now, maybe Dr. Bonifatius, looking ahead in terms of, not now that we know that men usually only come when there's a problem. They don't come when, should I really go to the hospital? This is an answer that I can deal with it. What are some of the exciting innovations and research findings, if there are any, in early detection and treatment that are perhaps most promising about prostate cancer in Namibia that maybe men should pay attention to, or basically the whole community, be it the young boy child, community health workers, and perhaps doctors themselves and everybody in general?
So we're so lucky that with regards to prostate cancer, we've got probably one of the most useful tumor markers. It's basically a blood test. It's called the prostate-specific antigen, in short PSA. And it has really changed sort of the landscape with regards to prostate cancer, because it helps us to early detect the cancer, even before you've got any clinical symptoms. So we implore everyone to come and do early testing. One, the PSA test, And two, of course, the rectal examination or examination of the prostate to see if there's any suspicion for prostate cancer. So that's with regards to the diagnosis part. We are now having a lot of different imaging modalities. I mean, with technology, there's a development of a lot of imaging modalities for us to be able to properly grade and stage the prostate cancer and sort of place men in a specific risk stratification group. And depending on this risk stratification, one can then assign certain treatment modalities to be able to ensure that men are cured of prostate cancer, especially if they do come early. The one reason why men really have to come early is because once it's detected early, one doesn't have to use a lot of treatment modalities to achieve cure. Instead of having to do bimodal or trimodal therapies, you can actually achieve this or accomplish this cure by just using one of the treatment modalities. With regards to treatment itself, we are now in the era of what we call precision treatment, where we really want to get a proper right balance between the desirable and undesirable outcomes of treatment. So in terms of prostate cancer, we're talking about oncological outcome, in other words, achieving cure, as well as the functional outcomes, which are the sort of complications that you get as a result of treatment, to try and make sure that those ones are kept as low as possible.
As possible. Now, Dr. Penoshinge, I mean, I'm told that there is a role of primary physicians and specialists and that there's a need for multidisciplinary approach when it comes to this issue. Now, for those that might be watching, what does this actually mean?
Approaching prostate cancer, like you correctly said, it's a multidisciplinary team that it starts from healthcare, like primary healthcare providers. So this involves, like I previously articulated, educating patients or the community. They should be aware of the disease so that they can come for screening. And those that present with symptoms, the healthcare providers as well, they have to be on the outlook or have high index of suspicion for this disease to screen as well as make a diagnosis and then refer appropriately, so that we don't have delay in patients being referred to our center. So when they come to us, there are a lot of things that we need to do. That starts with obviously a history, examine, and then you investigate and do the investigation that involves a PSA that Dr. Steenkamp have talked about. And then when it's indicated, then we do a prostate biopsy, and then we risk stratify and stage our patient using all those that the history examination and then the imaging modality that he also talked about. And having made a diagnosis, then we consult our colleagues from oncology, and depending on the stage of the disease, then we treat the patient accordingly.
It appears to be that it's a long chain of activities. Many people are involved.
Exactly,
So
yes.
all the steps are important. Now, Dr. Steenkamp, if I'm a man and I'm sitting and I'm thinking to myself, where do I start? At what age? Where do I go to? Who do I go to?
Just before I answer that question, I just want to go back to the question that you asked. I think one of the other important reasons why we really have to have a multidisciplinary approach is also because in Namibia we've got what we call a cancer registry. And I mean, for us to accurately update this cancer registry, we need to come to oncology and discuss these cases. And that's where we will know which are the most prevalent sort of malignancies in Namibia, but we'll also be able to know what are our shortcomings with regards to capacity building. So I just wanted to add up on that point.
Thank you.
Now coming back to your question, so the guidelines actually have an age of 40 But as you know, guidelines are developed in different geographical settings and population dynamics. In our case, we have lowered it a bit to the first baseline PSA, that's the blood test that I was talking about, to be done at 35. And depending on whether this PSA is less than 1, your next, obviously, PSA can be done at age 40. If it's more than 1, or where you have got risk factors, these are what I talked about earlier, family history, men of African ancestry, then you have to do follow-up yearly with PSA, so that one cannot miss the diagnosis of prostate cancer.
Brilliant. Now, let's shift our focus to the Southern African Prostate Cancer Summit, which is a major event specifically for Namibia and perhaps a continent as well, and the southern part of the African continent. What inspired this partnership that's between the German Cancer Research Center as well as the University of Namibia for this important initiative?
Okay, like we have said already, according to the Cancer Association of Namibia, prostate cancer has now become a major health concern to our country, and the German Research Cancer Center had already some research going on with UNAM, and with this new development, they saw that there is a need for them, or as well as our country, to invest in this, because this is now becoming a health concern. And this what has inspired this summit. And it's going to be a very beneficial event to our country, as well as Africa as a continent.
Okay. Now, Dr. Steenkamp, unfortunately, we are running out of time. Perhaps a recap in terms of these details. We talked about it in the beginning. Let's talk about where the summit will be held, what time it is starting, what are those dates, who is invited to attend. We understand there's also multidisciplinary panels and workshops. What does Namibia stand to benefit? Is there room for opportunities in terms of partnerships to be built after this conference?
Sure. The summit is going to start on the 15th of May and ending on the 17th of May. That's just over a week. Next week we'll be starting. And it's going to be held at UNAM, the Dr. Hage Geingob Medical School. We have a lot of distinguished international speakers who are experts in different fields, be it diagnosis, imaging, epidemiology, oncological sort of radiotherapy treatments, as well as surgical treatments. And we're really looking forward to it. We are also very much delighted and blessed that the president, Dr. Netumbo Nandi-Ndaitwah, our first female president of the Republic of Namibia, is going to be our guest speaker at this event. And we're really looking forward to it. I think one of the most important things that the Health Profession Council is mandated with is continuous professional development through continuous medical education, just to make sure that as health professionals we are all kept up to date with not only the conventional treatment modalities, but also sort of newer, novel treatment and diagnostic modalities that come up. And these experts will obviously share this information with us. And so I think we'll really benefit a lot. And it's sort of, as you said, multidisciplinary with different fields covered.
Well, thank you to both of you for making time to speak to us this morning.
Thank you very much.
Okay, that was Dr. Penoshinge Shikonga, as well as Dr. Bonifatius Steenkamp. Both are urologists, talking to us about the fact that the First Ever Prostate Cancer Conference will be taking place from the 15th to the 17th of May 2025 at the School of Medicine, that is at the Dr. Hage Geingob Campus, right here in Windhoek of the University of Namibia. This landmark event brings together various experts to promote early detection, share the latest research and public awareness on prostate cancer. So definitely something to look out for and not to miss. But however, stay tuned as Denver Kisting is bringing you the news at 7 after the short break.